Hi, I'm Masako Barrows. I'm the healthcare consultant at the Lawrence Associate. And today I'm going to present the new policy, the fixed patient-to-nurse ratio. In this presentation, I'm going to present the need for this new policy and how we are going to implement the policy and how we evaluate the policy and the budget and the target results we expect to come after this implementation of this policy, and we conclude the presentation. In the United States and throughout the world, we are facing the nursing shortage. In the United States, there are two main causes to it. First, it is aging nurses. According to the U.S. Department's Health and Human Service, the average age of nurses is now 50. Now, this includes the nursing educators, clinical instructors, and preceptors at the hospitals. And 53% of all nurses are now aged over 50. So if the replacements of these old nurses who are going to retire in next 15 to 20 years, if we are not successfully replace these nurses, the nursing shortage is going to be worsened. Another cause for this is aging populations. U.S. Census Bureau presented this increase of older generations in our society. In this graph, this green portion of the bar represents the independent generation whose age is between 19 and 64. And this red middle portion of the bar represents the dependent generation whose age is younger than 18, those children. And then this orange portion of bar represents the old age adults whose age is older than 65. In 1980, only 19% of the old generations are older than 65. 30 years later, 2010, it increased to 21%. This is a small increase, but it will predicted to steadily increase this percentage. In 2020, the older adults portion is 28%. And by 2030, it is going to be 35% of all population is going to be older than 65. This data is very significant because older adults has a high demands of a healthcare system compared to younger generations. With this information, with this data, and the aging nurses, if we do not do the strategy, the nursing shortages will come to realized in every healthcare system. The ramification of nursing shortage is significant, and it has a vicious cycle of nursing shortages, because when there is not enough adequate number of nurses at the hospitals, high number of patients are going to be assigned to a nurse, and that creates a poor patient outcome. And then nurses are stressed, and then the level increases. If the problem is not resolved in a short amount of time, those nurses turn over the job or the nursing profession itself. In April 2015, the Senate Jeff Merkley and the Representative Lois Cappas from Democrat and David Joyce from Republican introduced this registered nurse staff self-staffing act in the House. This Safe Staffing Act requires hospitals to have adequate number of nurses, registered nurses, providing direct care to patients in each shift and in each hospitals. This bill hasn't passed as a national law, but 7 states, Washington, Oregon, Nevada, Texas, Ohio, Illinois, and Connecticut are enacted and regulating the patient-to-nurse ratio. And in California, it has already the state's Safe Staffing Act in the states. So therefore, they have been practicing or regulated those staffing numbers. But New Hampshire and many other states are not regulated, and then therefore the hospitals are creating the patient-to-nurse ratio based on their budget, or they create a policy such as mandated overtime working. But those policies does not solve the problem and increase the patient care. So our hospital, I would like to introduce the fixed patient-to-nurse ratio that ensures the safety of the patients and then the nurses. When poor patient outcomes become chronic, and the nurses' stress level increase. Those stressed nurses are studied to feel guilt, and they feel incompetent, they feel inadequate, and become exhausted. And those exhausted and tired nurses could turn over their job or turn over their profession as a nurse. This new policy, how we implement, is going to take 5 stages. The first, we would like to conduct a survey among the nurses, registered nurses and licensed nurse assistant. And then we will try to, identify the problems. And we analyze those data and also the protocols and evaluations and outcomes of the Californian hospitals that they have been practicing this Safe Staffing Act. And then after analyze those data and information, we make a decision. And then we implement those ratio by hiring new nurses if necessary, and then we evaluate after 6 months. The evaluation process takes a similar process and takes 5 steps also. First, we take a survey among the nurses and licensed nurse assistant. And then we collect the data and we analyze. Then we evaluate the patient outcomes and we adjust, if necessary, those ratios. And this evaluation process will be repeated 4 times at the 6-month, 12-month, 3 years, and 5 years marks after the implementation. We believe that the repeated evaluation is necessary to bring the positive changes through this policy, and then that positive change to be the last and long-term change. And the budget for this project is about $48,000. This cost is to pay the patient who involved in this project. $7,000 for healthcare analyst, and then $10,000 for healthcare statistician, and $25,000 for payments to Lawrence Associate, who works up to 400 hours of work, and then $6,000 to 3 employees of the Apple Valley Regional Hospital who will conduct the evaluation processes 4 times. So we provide a $500 bonus to each employee for completion of each evaluation. Now, this is not included the possible new employments of the nurses, because we do not know, we have not determined yet how many nurses we will need or we may not need. But if we are going to hire new nurses after determining the patient-to-nurse ratio, we need to add the salary to those new nurses into this budget. The target results for this policy is ultimately high retention rates of registered nurses. The retention of experienced nurses that is caused by the increased job satisfaction, because the environment is fixed and then adequate and appropriate. Because those environments create better patient outcomes with happy nurses and satisfied nurses who don't feel guilt, incompetent, but motivated to learn more and advance in their educations. In conclusion, I would like to emphasize this new policy, the patient-to-nurse ratio, fixed patient-to-nurse ratio, ensures increasing the quality of patient care. Through quality patient care, we will respond to the demands of the healthcare needs in the community, and they will maintain their trust in us, and they will provide needed, adequate, and quality patient care to the people in this community. Thank you.